symptoms of hypothyroid. So you have weight gain, trouble losing weight, constipation, low body temperature, sensitive to temperature change in general. When other people are cold, you're typically freezing. When other people are warm, you're typically hot. Or other people are comfortable, you could be hot or cold. And then high cholesterol is also a symptom. Dry skin, hair loss, depression, low energy. They're all symptoms of hypothyroid. It's not always hypothyroid, obviously, but those are all symptoms of hypothyroid. Many people, they're even treated for hypothyroid. They have tests done, TSH, maybe free T4, and their TSH can be high. It's an inverse relationship when it comes to TSH and the thyroid. It's a thyroid stimulating hormone. So, and they may be diagnosed and treated with levothyroxine, synthroid, but they still have hypothyroid symptoms. So there's about 10% of the population, and maybe more, but in terms of the data, that if they have a thyroid condition, the levothyroxine is not enough. The synthroid is not enough. That they actually need the T3, the levothyroxine, the cytomel. Most doctors don't even test for the free T3. Free T3 is the actual active thyroid hormone that the body uses. The T4 is converted to T3. So I've seen quite a number of patients that they're being treated for hypothyroid, their TSH looks perfect, their free T4 looks perfect, nobody's tested their free T3 is low, they still have hypothyroid symptoms, and when you treat them properly with free T3, their actual hypothyroid symptoms get better. There was a woman with depression. She was actually on Social Security disability for depression. She had been tested for all different conditions, especially thyroid. Only tested her TSH and free T4. She's on Social Security disability for depression. She came to me. Her body temperature was low, 97.3 on a regular basis. And that's one way to tell if somebody's body temperature tends to be low, and you have all the clinical symptoms of hypothyroid. You may have hypothyroid. You can't just go by a blood test, because many times you do the blood test and you have a range with the blood test, right? So you have, like for free T4, 0.9 to 1.8. Let's say you're at 1. And you're, okay, so you don't have hypothyroid because you're at 1. But for you, what is your ideal? Maybe you should be at 1.8. For the free T3, the range being 2.5 to 5. Maybe you're at 2.6. Oh, you don't have hypothyroid. But for you, your ideal is to be at 5 or 4.9 or 4.8. So, I mean, in terms of what's right for the individual correlates to clinical symptoms. So this woman, for example, body temperature 97.3, free T4 was perfect, TSH was perfect. Nobody ever tested her free T3. I tested her free T3. Her free T3 was low. It was at 1.9. So I treated her at the time with levothyroxine, the cytomel, and within a month, her depression, she came in smiling. Her depression was gone. And she knew, like, in general, some things happened in her life, and, that would cause sadness. But you could tell, I mean, she wasn't a depressed individual, based on her constitution. It was hypothyroid, it was biochemical. We treated it, she no longer has depression. Another woman in her 70s who came in, morbid obesity, depression, high cholesterol, constipation, low body temperature, every single symptom. Her blood tests were perfect. Her TSH was perfect, her free T4 was perfect, her free T3 was on the low side at 2.5, technically not hypothyroid. Clinically, she has hypothyroid based on all of her symptoms. Treating her with Armour, the natural porcine-derived thyroid. After a couple months, she's coming in, she's like, I can't believe this. I'm not depressed anymore. I'm not at home crying for seemingly no reason anymore. So, one, the symptoms have to be recognized. Two, the right tests have to be done. Three, clinical presentation has to be taken into consideration. And then also, certainly it can just be a deficiency of iodine, selenium. You need iodine to produce the thyroid hormones. And certainly, in the Midwest and most people that follow more of an American diet, they don't get enough seaweed, to have their iodine high enough. And a lot of people are using sea salt that's not iodized sea salt, so they're not even getting it from there. And their iodine is deficient. You can do a blood test for the iodine as well, which we do, and I find many people, the vast majority, are deficient in iodine and selenium. So one thing that we have the Kelp Plus formula that kelp as a seaweed, very high in iodine. So, and we add selenium to the kelp, so you're getting both of the common deficient elements that are tied to thyroid hormone production with our Kelp Plus formula. So, to be aware of the symptoms, and then to do the right testing, TSH, free T4, free T3, test iodine, test selenium, do the right treatment. You might be on thyroid medicine already, the levothyroxine or the synthroid. If you still have hypothyroid symptoms, you want to push for the right test, adding the free T3 to your testing, checking your body temperature. Clinical presentation matters. Blood tests don't lie, but blood tests don't give you a human perspective of what's really happening with somebody. You have to actually talk to the individual, talk to the patient, see what's really happening, do the symptoms fit. So, God willing, a little bit of perspective, if you have any of those symptoms.